The time interval from the 9th to the 13th century remained known as the Golden Period of the Arab science, and a significant place among the taught sciences are occupied by medicine and pharmacy. In the history of medicine, Islamic medicine, also known as Arabic medicine, refers to the science of medicine developed in the Islamic Golden Age and written in Arabic. Arabs were able to use their cultural and natural resources and trade links to contribute to the strong development of pharmacy. After the collapse of the Arab rule, the Arab territorial expanses and cultural heritage were taken over by the Turks. Although scientific progress in the Turkish period slowed down due to numerous unfavorable political, economic, and other circumstances, thanks to the Turks, Arab culture and useful Islamic principles expanded to the territory.
The Muslim Halifax continued to follow the practice of the Holy Prophet Muhammad by appreciating and supporting the doctrine, and unlike the common practice of other conquerors, they forbade their armies to destroy the libraries for the objective respect of human search for knowledge. First, they built a strong and remarkably stable empire on the great expanse of the Middle and Far East, and in the northern part of Africa and southwestern Europe. Arabian exhortations, their culture and science have spread to the front of Asia, the Mediterranean and the Arabian Peninsula towards the Far East. This has allowed them, wherever they come to be conquerors, to propagate the culture and customs of the indigenous population by developing their own culture in newly established areas. In those countries that are largely part of Alexander the Great's empire, the Arabs have come to know the traditions of Hellenism and, with that, Greek medicine. In addition to the Greek as the most important, they inherited the books of Romans, Indians, Chinese, Persians, Syrians, and other nations. The Arab rulers, and especially the Caliph al-Ma'mun in the 9th century, gave a special contribution to the development of science through the establishment of translation schools in which these books were translated into Arabic. Thus, Arabic language became the language of intellectual progress throughout the Muslim world throughout the Middle Ages. Among the first translated books are also books of great importance for the development of pharmacy. Such are, for example, the Book of Herbs of Greek Theophrastus and Dioscorides de Materia Medica, a book that encompasses an overview of ancient pharmacy and medicine. Using these, as well as numerous other books of Greek medicine, the Arabs have taken over the theory of Greek art of treatment, primarily in the forms suggested by Hippocrates and Galen. They then added their own experiences that arose as a result of many years of research and re-examination of what they had accepted from previous civilizations. One of the most important periods in the development of medicine at all, especially medieval medicine, is the so-called Golden Age of Arabic medicine. In the history of medicine, Islamic medicine, also known as Arabic medicine, refers to the science of medicine developed in the Islamic Golden Age and written in Arabic. The books of Arabic science that came about in this period are not only by Muslim authors, but Arab civilization is the result of consecutive, persistent, and continuous efforts of various nations, regardless of the religion, race, and color of the skin, who lived and produced in the Arab region. It is also important to emphasize that Arabic medicine and pharmacy are the pluralist spirit. Arabic and the Turkish health system was based on several traditions that complement each other. The basic medical tradition was certainly Greek, but it was influenced by Islamic or prophetic medicine, and, to a lesser extent, by folk medicine. Islam in the development of Arabic medicine and pharmacy was, above all, a motivating factor. The belief that God creates a cure in nature for every existing disease has led to the development of pharmacognosy. The Quran as a moral code of the Muslims has evolved the development of professional ethics, and the need for ritual washing has given rise to the cult of water in Islam, thus pointing to the importance of hygiene and preventative medicine. The knowledge of medicine spread to the Islamic Caliphate between the fall of the Roman Empire in the 5th century and the European Renaissance in the 15th century. Nevertheless, the true blossoming of Arabic medicine and pharmacy begins in the 9th century and coincides with the golden age of the Abbasid Caliphate in the East, 749-1258. By establishing Abbasid Caliphate, centers of all activities, and also scientific, are moving from Syria to Iraq. The newly founded city of Baghdad becomes the capital and the center of culture and science of the empire. Significant centers of learning were also cities like the previous capitals, Damascus, Cairo, and Córdoba and Granada in Spain. In these cities, scientific institutions, schools, libraries and hospitals have been built, and soon the first pharmacies, whereby doctors or wise men from all over the world come to these cities. They were dedicated to collecting data and orchestrating scientific development.
The most significant books from alchemy in the early Abbasid period were written by ar-Razi and his contemporaries Ibn Washiyah. Due to the great tendency of Arabic chemistry and abundance of precious drugs arriving in Arab cities from the Middle East and the Orient, it is said that pharmacy has started its professional existence with the Arabs. Thanks to the basic knowledge of medicine and biochemical science, Arabs have become experts in the preparation of numerous pharmaceutical preparations such as concentrated herbal juices, called rub and julep, syrups, electries, purgatives, sweetened and silver pills, distilled aromatic waters, essences and aldehydes and alcohols as solvents, but also for other purposes. The birth of pharmacy as an independent, well-defined profession was established in the early 9th century by Muslim scholars. For the history of pharmacy, it is very important that in Arabic countries are found the first beginnings of pharmacy as an independent profession. They set up the first hospitals with permanent pharmacy and hospital apothecary. The early distinction between medicine and pharmacy begins in the 7th century. One of the most influential Arab scientists, al-Biruni, states that pharmacy became independent from medicine as language and syntax are separate from composition, the knowledge of prosody from poetry, and logic from philosophy, for pharmacy is an aid to medicine rather than a servant. Another Arab scientist, Saba, d. 869, wrote the first text on pharmacy. It was the first Arab collection of formulas. Any distinction means reported progress and training, which can only happen when all conditions are met. That is why the emergence of pharmacy as an autonomous science and profession means that social forces and developments have reached such a degree of development that they have made it possible to distinguish it. Some of the main causes for the emergence and development of professional Arabic pharmacy were increased drug demand for the growing population and the availability of the same on the market, a singular intellectual curiosity, and the rapid translation of medical books. About the opening of the first private pharmacy, which marks the ultimate independence of pharmacy on medicine, many historians have written. Many of them note that the first apothecary was opened by the Khalifa al-Mansur in Baghdad in April 754. But the fact is that Baghdad itself was founded and completed 10 years after the mentioned year. It is therefore claimed that the first pharmacies in Baghdad were open at the time of the reign of al-Mansur's son, and that it was not possible to determine whether they were owned by non-educated pharmacists or by pharmacists who had certain academic training. It is therefore claimed that the status of a recognized profession reaches in the early 9th century when practiced by trained and educated specialists and pharmacists who were fully aware of the ethical and technical responsibilities of their vocation. Thanks to the circulation of the aforementioned information on the contribution of medical and biochemical science to pharmacy, it is no surprise that Arabic pharmacists presented a great opus of new techniques and substances, as well as having established a monopoly in the distribution of pharmaceuticals. The role of a professional educated pharmacist in society was not ignored, but was, on the contrary, welcomed. Profession and the role of pharmacist was first defined by al-Biruni in his book Sidana Fit-Tib as follows: a professional who specializes in collecting all medications, choosing only the best from simple and complex, and in preparing good medicines, follows the most accurate methods and techniques that are recommended by the treatment experts. 1. This pharmacist's description differs slightly from the modern one. Al-Biruni promoted the idea of academic training for pharmacy students and emphasized that pharmacology, knowledge of how medicines work on the organism, is more important than mere preparation. In his book, al-Biruni also performs the Arabic name for pharmacist as-Sidinani or as-Sidilani, which would mean the one who sells sandalwood, because the trained pharmacists used this aromatic plant from the 8th century. On the other hand, herbalists did not use sandalwood so much. Intensive development of the pharmaceutical literature begins in the 9th century. Scientists who wrote books on the history of pharmacy sought to group pharmacy books into basic categories. Thus, historian Sami K. Hamama categorized into a variety of pharmacological literature into several basic categories. A book about forms and compendiums offered a big collection of formula and prescription medications, systematically arranged, e.g., alphabetically by the names of medicines. They contained instructions on formulation and preparation of medications, as well as instructions for use. The first form in Arabic was Saba b Sal in the 9th century and was called al-Akrabadan al-Kabir, translated by the Great Book of Medicines. After this book in the Eastern Caliphate, in the Western Caliphate, Dr. Ibn Abd Rabi writes al-Dukhan. In the next few centuries, compositions of drug formulas have continued to be written, either as independent books or as sections within the encyclopedias. The books about plants and about materia medica were under the influence of the Greek-Roman authority of Dioscorides. The Arabs have gradually written their additions to natural medicines from their own soil or from enterprising expeditions. Medicinal herbs were of extraordinary economic importance, so it was at the fingertips of doctors and pharmacists. Among the most important Arabic books in this area is the As-Sidana fit Tib of al-Biruni, physician in the 11th century. Even more extensive medicine is written in the 13th century by famous botanist Ibn al-Baitar, citing about 150 other authors, and describes around 2,000 medicinal substances of plant, animal, and mineral origin. Books of toxicology were in response to the risk of accidental or deliberate poisoning because poisoning was one of the popular personal and political weapons. These special manuals describe toxic substances and their effects, symptoms of poisoning, and often very complex and wonderful antidotes. Some of this knowledge came from India thanks to commercial and cultural relations, especially the many forms of tertiaki, the universal antidote of complex content that originate from the Greek-Roman antiquity. The Arabs contributed to the toxicology since Hunayn bin Ishaq in the 9th century to Ibn al-Suri in the 13th century. Books on diet and drug therapy by Arabs have paid attention to the importance of combination of diet and drug therapy more than the predecessors. The central concept of these books is that a sick person needs a different diet and way of life than healthy persons. The inspiration for creating this literature was given by Hunayn ibn Ishaq in the 9th century by translating relevant Hippocrates and Galen's books, but also by writing their original about this subject. Pharmaceutical books, as parts of the Arabic encyclopedia, sought to consolidate all the medical knowledge of their time into their encyclopedia books. They usually devoted 2 books, parts, to pharmacy in their multidimensional medical encyclopedias. The thrill of successful encyclopedists began by al-Razi, and continued by Ali ibn Abbas with an even more systematic and conclusive book and a great interest in ethics of medical care. Among the most brilliant names is Ibn Sina, who dedicates 2 parts of his famous canon of medicine to drugs, describing about 760 of them. His contemporaries in the Western Caliphate of the Empire was the encyclopedist Abu al-Qasim al-Zahrawi. At the beginning of the Middle Ages, European science was at a very low level of development. The reason for this was also the barbarian tribes who destroyed the libraries and valuable manuscripts that had been collected for centuries on several occasions. Due to these devastation, Europe lost and then forgot its cultural heritage. Meanwhile, the Arabs have collected the famous books of previous civilizations and on these grounds continued scientific progress. They taught the way of Europe with their doctrine that in the Dark Middle Ages their period of Renaissance began. By the 17th century, Western European medicine was the result of Latin translations of Arabic-based medical books. That Arabism begins with Constantine the African, who translated the books for the medical school in Salerno. He did not only translate Arabic translations of Greek books, but also the original books of Arab doctors. These translation activities were particularly pronounced in Spain in the 12th and 13th centuries. In the Latin translations of these books, and in particular Ibn Sina's canon, many medical courses were based on the universities of Europe. Translated by Creman in Toledo, and as soon as a Latin copy appeared, the book had a great glory. The first university that accepted canon was in Poland in the 13th century, and remained on the throne of the university until the 17th century when science-based medicine was born. In Montpellier, a large center of medical studies, parts of canon were included in official literature from 1340 to 1657, and at the universities of Leipzig and Tübingen from 1481. The medicine courses of the University of Vienna in 1592 and the University of Frankfurt am Oder in 1598 were also based on canon. The Arabic texts of canon of medicine were also available in Bosnia and Herzegovina at the beginning of the 20th century, and were used by some folk doctors. From the point of view of science as a method of research and analysis, Today's scientists are direct heirs to Ibn Sina and his predecessors, ar-Razi, Galen, and Aristotle, because their mode of presentation gives the impression of a concept that is true for all times. Apart from canon, many other encyclopedias such as ar-Razi al-Mansuri and texts of unofficial Arabic pharmacopoeia have been included in European pharmaceutical texts, thus encompassing books describing grass and formulas all the way to modern times. Common practice of Arabs was to give specific names to medications based on their pharmacological activities, as we know that today is a common practice followed by modern medical patents in the West. So they came to the modified Arabian teriyaki, the universal antidote, the combined medicine found by ancient Greeks and perfected Galen. Tertius and other antidotes were adopted in several Arab formulas, some of which contained over 60 ingredients. The West was fascinated by the marvelous effects of such combined drugs and were sold there by astronomical prices until the 18th century. Also, the differentiation of pharmacy and medicine that took place in the Arab world for the West has played a significant role. Their teachings and arrangements were established by the Arabs in Sicily during the occupation from the 9th to the 11th century. The Arabian regime served the Roman Emperor Friedrich II in 1240 that he adopted the constitutions governing the health system, which included the part related to sanitary legislation on the separation of medicine and pharmacy. That part of the Friedrich's constitution was called the Sicilian Edict, but as it was set up by the medical school of Salerno, it was known as the Salerno Edict. Thanks to the great contribution of Arabia, pharmacy and medicine were legally separated, and this model will be familiar with Sicily via the rest of Europe. Arabic civilization has played an invaluable role in preserving the continuity of scientific progress. Its greatest contribution was that it was collected in critical moments for humanity, when the numerous cultural barbarians have destroyed the world's cultural heritage. Rescuing the supreme books of ancient civilizations, Arabs, unlike many conquerors, have shown an objective respect for the human search for knowledge. These books have accumulated on the Arab soil, translated and built on their foundations.
The Arabs from the primitive disbanded tribes in the recorded time have yielded the brightest culture known to the world of the Dark Middle Ages. Thanks to Arabs and European cultural renaissance, the scientific revolution was possible. Thus, the time interval from the 9th to the 13th century remained known as the golden period of the Arabic science, and a significant place among the taught sciences are occupied by medicine and pharmacy. Arabs were able to use their cultural and natural resources and trade links to contribute to the strong development of pharmacy. After the collapse of the Arab rule, the Arabic territorial expanses and cultural heritage were taken over by the Turks. Although scientific progress in the Turkish period slowed down due to numerous unfavorable political, economic, and other circumstances, thanks to the Turks, Arabic culture and useful Islamic principles expanded to the territory of our homeland of Bosnia and Herzegovina. Significant role in the transfer of Arabic pharmaceutical knowledge was also attributed to the Sephardic Jews who, with their arrival, continued to perform their Adar activities, which were largely based on Arab achievements.
Thanks for watching. Please subscribe, like, share and recommend.